Integrative medicine, I think, is the medicine of the future. It's what people want. I think doctors are not being trained to provide it at the moment. We're trying to correct that at the University of Arizona. Integrative medicine looks at the whole person. It looks at physical, mental, emotional, and spiritual aspects of illness, and it makes use of all available modalities of treatment to promote healing in the human body. So it's, above all, healing-oriented medicine that works from the premise that the body can heal itself if you give it a chance.
Dr. Andrew Weil is a pioneer in the integrative medicine movement. This once controversial approach to healing is now being practiced in clinics across the country. In upstate New York at University Hospital's Complementary Health Center, Dr. Samuel Benjamin incorporates a wide range of alternative methods to treat his patients.
We provide services in acupuncture, guided visual imaging, or mind-body medicine, tai chi and yoga, osteopathic manipulation. We're exploring the use of chiropractic with the community and getting involved in research in that area. We look at herbal medicine. We're exploring homeopathy and use it to a certain amount. And we're collaborating with colleagues around the world in that regard. So we cover a lot of areas. We're thinking about dance and exploring this within the university because our program is not just in the medical school. It's in social welfare. We deal with social workers, health sciences and technology management. Even people who are learning how to look in a microscope and read slides of pap smears are learning about complementary medicine. We deal with the School of Nursing and the School of Dentistry and the School of Medicine. So we're looking at a broad array of areas to train people. We're trying to train our community, train health professionals, and develop research so that we can have better reliability about what works and what doesn't work.
Many of Dr. Benjamin's patients come to him after exhausting every other possible avenue of treatment.
We came to see if we can get some extra help for my son Brian, who has been diagnosed with a communication disorder when he was 3 years old, and since then has been labeled as autistic. We wanted to find some alternative solution to any medications because we don't approve or believe in that unless it's a last resort, and hopefully we won't have to go that route.
Brian is an example of that, diagnosed with a communication disorder and sent us by a pediatrician. His family was desperate. They had lost hope. They were told that the medication for his particular problem would be of dubious value, and they were concerned about its toxicity. So was their pediatrician. So when they came to us, we offered them some options. And you know, there really isn't a lot that is that special because you see a lot of integrative medicine is common sense. It's not necessarily related to the product that we use, but the way that we used it. We recommended homeopathy, not because we know that there's evidence that it works, but because we thought it was a reasonable option to try. We didn't think it would do any harm, and we had nothing else to give him. There were no other avenues. We got involved with his family. We encouraged prayer and spirituality. Even though we were realistic, we gave them hope. Those things make a big difference.
Basically, when we use alternative practices for medicines that we're doing with Brian, we have been told that there's no proof that anything could help him, but we've also been told that there's no harm that can be done by using these practices. And we've seen the progress, so we know they're helping.
Supporters of integrative medicine emphasize its individual approach to treatment.
But a lot of what it's utilizing is the healing relationship between two human beings, one of whom at that moment happens to be a healthcare provider and the other of whom at that moment happens to be a patient. And within that space, a lot of healing takes place. And then utilizing what might be best for that given individual, as apart from any other person who walks into the room, for that given individual to help them heal, let their own body utilize whatever it can, along with other activities, conventional and alternative, so that they can heal themselves.
While critics may point to a lack of scientific study validating its results, the practitioners of integrative medicine remain faithful.
I don't know what the American Medical Association thinks about our overall concepts, but I do know that they are disturbed about the development or introduction of complementary and alternative medicine services before what they feel is reasonable evidence. I share their concern about evidence, but I also am very concerned about the large number of prescription drugs that I believe has been estimated to be 40 to 60% of all prescription drugs used in the United States that have been written off-label, that is to say, without any studies to support this use and without the approval of the Food and Drug Administration. So there needs to be one standard of care. If we're going to apply it to alternative medicine, then we're going to apply it to everything else. If not, I think they should take their hands off and stop saying things because it's somewhat hypocritical.
As we enter a new era, the very nature of healthcare may be changing as people take a more hands-on role in their own therapy. And thanks to visionary physicians like Dr. Weil, the prognosis is a healthy one.
I would say that this movement is unstoppable, that this is clearly what patients desire and that economic forces are driving things in this direction. So it's very much in the interests of physicians to work to correct defects in their medical education and also to lobby for medical schools to change their curriculum so that they're preparing physicians to provide the services that people want and need. And I would also say from my own experience that practicing medicine in this way is much more rewarding, that you work with patients who are motivated, who want the information to help them make changes in their lifestyle, and you can often produce very real positive changes in how people feel.